All right. Thank you all for joining us as we mark this important milestone in our efforts to revitalize San Francisco. It is now my great honor to introduce Mayor Daniel Lurie.
Thank you. Thank you. Good afternoon. Thank you to the Millennium students for being here today. We appreciate you. Sharky, good to see you. Good afternoon, everyone, and welcome to City Hall. I want to first start by thanking Supervisors Dorsey, Engardio, Cheryl, Mahmoud, Souder, Chan, and Chen for joining us today. I also want to thank our community partners for standing with me on the steps of City Hall just 2 weeks ago to advocate for the passage of the Fentanyl State of Emergency Ordinance. It's an honor to be standing alongside all of you today to sign this legislation into law. On Inauguration Day, I committed to treating the fentanyl crisis as the emergency that it is. Thanks to the overwhelming support of the Board of Supervisors, we are getting additional tools and authority to act swiftly and effectively. We did not get here alone. Thank you to my legislative co-sponsors, President Mandelman, and Supervisors Dorsey, Engardio, Cheryl, Mahmoud, and Souder. And thank you to Supervisors Chan and Fielder for working closely with my team on amendments to get this piece of legislation over the finish line. The fentanyl crisis is not a 9-to-5 operation. It doesn't take breaks, and neither will we. This new law will allow us to further surge resources and bypass bureaucratic hurdles standing in the way of tackling this crisis. Today, as we sign this consequential piece of legislation, I am proud to share the first step we will be taking with this new authority. Thanks to the Fentanyl State of Emergency Ordinance, this spring we will open up a 24-hour, 7-day-a-week police-friendly stabilization center at 822 Gary Street. The center will be staffed by medical professionals. It will divert people from the emergency department at places like SF General, and it will accept patients dropped off by police, paramedics, and street crisis response teams. This will free up essential hospital and first responder resources. Using new leasing provisions provided by the Fentanyl State of Emergency Ordinance, we will act quickly. To those who are struggling, help is on the way. We are putting in place solutions that will reach you and give you the second chance you deserve. To our first responders, law enforcement, public health clinicians, community health leaders, thank you for your tireless efforts. Your work does not go unnoticed, and together we are making bold steps toward a healthier, safer community. This is our moment to act, and together we will continue to push forward until the fentanyl crisis is behind us. Now, I want us to get to work, and it is my honor to introduce our next speaker, Supervisor Matt Dorsey.
Thank you. Thanks so much, Mayor Lurie. 5 years ago, San Francisco faced a public health crisis in COVID-19. And around that time, there was another public health crisis that I don't think people were fully paying attention to, but they're paying attention to it now. And I have talked about the fact that this was a crisis that moved me to ask for a job and a role on the Board of Supervisors that I never thought I would want, let alone have. But I was working at the police department under Chief Bill Scott, and I had a role where I participated in the monthly meeting to preview the report on how many people died of drug overdoses the month before. And month after month, as a recovering addict myself, I looked at a number that I was one bad decision away from being in. And like many people in the recovery community at that time and now, we knew that the drug overdose crisis was literally twice as deadly as what we were seeing with COVID. It means the world to me, and I know that it means the world to the recovery community in this city and elsewhere, to understand that San Francisco is rising to the challenge of the fentanyl emergency that we are facing, and doing so in a way that will save lives and also protect communities from drug-driven lawlessness, because that is something that I'm hearing. I represent neighborhoods that have been very frustrated when they see that the city is going to solve a problem. They're seeing problems that the city is creating. And I think what I appreciate about the 24/7 Stabilization Center that will be police-friendly is that this is addressing both the needs of people who are struggling with addiction and the right of our neighborhoods to be free of drug-driven lawlessness and to restore public order to our city. So thank you, Mayor Lurie, for your leadership, and I'm honored to be a part of this. Thank you.
We'd like to introduce one of our community partners, Cedric Akbar, to come up here and speak as well.
All right, good afternoon, everyone. Doing nothing about the fentanyl crisis is no longer the answer. The answer will happen today, as Mayor Lurie is taking this bold step to sign this enactment and to sign this into law today to be able to give our city and make it safe again. I want to say that it's going to take an integrated approach to this. It's going to take every city department. It's going to take each one of them to work together to be able to rid our streets of the pandemic that has been going on the streets. The other thing is, as a collective in San Francisco, we need to work together to San Franciscans and support our mayor, support his leadership in this walk in order to bring our city back. The other thing is safer sidewalks. We all want that again, for every citizen in San Francisco to be able to walk down the streets again, especially our children. We want to be able to tell those that are suffering from substance use disorder that there is help, that you can stand up, that you can live again, that there is hope for you. And I pray that it'll be provided with more treatment beds and more places for people to go to get the help that they need. And today, this is a day for us at San Francisco to be able to stand up together, pull ourselves together as one, individually and collectively, to make this a better city. Thank you.
All right, I'm happy to take a few questions before we sign the bill.
So with this expected to have, 25 people each day, how many more treatment centers are we going to need like this one, or is your office planning to try and get leases for it?
25 a day is a start. It is not the ends. We need more spaces like this, but we haven't had any except for instance, General Hospital, where if you walk into SF General, you see people lined up waiting to get treatment because their beds fill up very quickly. So this is a first step, but it is just a first step. You're absolutely right. We need more.
What the horizon is for this? What does success mean as part of this legislation? What does it mean that you are successfully doing what you're doing?
Well, I think Cedric hit it. And I, during the campaign, would walk in the Tenderloin. I'm walking 6th Street. I'm walking Julian Avenue. And sometimes I'm picking up my daughter from ballet or my son from soccer practice. And I will not, for instance, on 6th Street, get them out of the car when I'm walking up and down the street. Success for me will be able to look like that any one of us can take our kids down one of those streets and feel safe doing so. This is going to take time. I appreciate the Board of Supervisors and their commitment to this. We have a year of this ordinance. I hope you and I see really improvements in street conditions so that our kids who are here with us today feel safe walking down these streets. That will be the first test. Numbers will come with what we've done at the triage center. Which we are piloting right now. We will have numbers, we will have data, and the data will drive us. And we're not going to be content with just fixing one street and having the problem move down to the next street. I am going to be tireless about this. I sat at the DMAC meeting and I said to every department head this morning, I said, this is not a let's clean up for the NBA All-Star game or let's clean up for the Super Bowl. We're cleaning up this city for the residents, for our children, 365 days a year. They deserve nothing less.
The other half of this problem is, of course, the dealers, people who come to the city, come to this country, and are flooding the streets with fentanyl. So what part of this plan is going to address that? And is there going to be a collective agreement with the board to all get together and say no more with the dealers?
We are, I want my SFPD, my law enforcement, arresting those that are dealing. I've said that every single day, and that is their commitment to me. We made over 200 arrests in January alone. We are not going to stop. That's the duty of us, is to keep our people safe, and we will do that.
So I actually was just now in the mission, and I talked to this woman that she told me she's been on the street for 25 years, and she's had help before, including going to shelters. But then she comes back to the street.
Yeah.
So how are you going to guarantee that that doesn't happen and the streets are not, again, filled with people that actually might need to be forced into treatment?
Well, we're giving people a choice once we have enough beds, and that's where the Prop 1 funding that we are expecting to get in May, they won't be up until September, those Prop 100 locked beds. But we're going to give people true options: safe, dignified shelter, treatment beds, which we do not have enough of. But staying on our streets, being in tents is no longer an option for people when we get those beds up. What we're doing on 6th Street, we are going to continue to let people know that they have options, but there is no longer an option to stay on our streets. JD, I know you want me to get into specifics. I have not signed the law yet. I have not made a phone call yet. We abide by all the laws, and I respect the will of the Board of Supervisors, so I'm going to sign this bill. And believe me, there's people that want to help this city in a variety of capacities, whether it's on this or whether it's on other topics. But for right now, we need to stand up more mental health beds, more shelter beds, and I know there are people interested in that, and we will be happy to share the details, and the Board of Supervisors will know it. The public will know who we are talking to and who donates. There will be full transparency for the public.
I mean, it's not only people that come from other countries, people from here are also doing it, but we also heard people from Oakland, from different cities that come to San Francisco to sell fentanyl. How are you partnering or working together with the DA's office to make sure all these dealers are contributed and they're okay out of jail?
Let's not equate two things. There's immigration issues and then there's drug dealing issues. If you are here in San Francisco, I don't care where you're from, if you're dealing drugs, we're going to arrest you and we're going to prosecute you. Full stop.
Transparency comes in a lot of different ways, and I'm just hoping to hear from you. What is your commitment to how soon the public will hear about who you're asking money for your plans, and on an ongoing basis also? Is this going to be daily, weekly, as soon as you make the ask?
Well, as many times as you ask me the question, Joe, listen, when we get a donation, the Board of Supervisors is going to know and the public's going to know. That's my commitment. I am not going to call you every time I make a phone call, but I know you would. I know. That's what I love about you. But Joe, I am committed to transparency in this. There's not going to be donors giving money that you all don't know about. All right, let's go sign. Thank you all for being, thank you all the department heads, Dean Crispin, Chief Bill Scott, thank you very much. Thank you all very much.